Welcome to the Medicare Team podcast. My name's Joshua, and I'm joined with Sean.
Hello, Joshua.
Hello,
I'm
Sean. We're both licensed agents here at the Medicare Team, and we're looking forward to helping y'all out today. And today's topic's actually going to be towards veterans and how their coverage relates to Medicare and how that can all work, kind of overview of it, because that can be very, very complicated to deal with, because you got Medicare, and then you got the VA, and then some people, if you're retired, you got Champ VA and TRICARE, which is a separate program for those who are retired and their families from the military. All that's can be super confusing. So
There's a lot of coverages in there.
you have
Confusing.
access to a lot more benefits because you served our country. And those who are watching that are veterans, I do, first of all, want to thank you for your service. We are very grateful here
Thank
for all
you.
that you've done, and you deserve all the benefits that you guys are entitled to. So our goal here is to help you take advantage of anything that you may be missing on the Medicare side. So we're going to do an overview and this episode is going to be kind of like a two-part episode, and then next week we'll have two of our fellow veterans here within the office. I'm not a veteran, but our two veterans that work with us here, and they're going to go into a little bit more of those benefits in detail. We're just going to do kind of a broad overview on how it all works. It's going to be a little bit more educational today.
For sure.
All right, well, let's get into it. What coverages do you have? So you have the VA. So someone who served honorably discharged gets access to VA coverage, and then VA coverage, you normally have to get it from like a VA facility. So there's VA doctors and facilities around, and then you can also get medications through the VA as well. So the VA does come with medication coverage, and there's a level system in the VA. Talk with your VA. Talk with your local VA on how that all works and what level you're on and what you have in there. We're not going to go into too much detail on that today, but so just check with your local VA to see what you're entitled to there. And then there's Medicare. So when you turn 65, you become eligible for Medicare, and that's civilian healthcare. So that's outside the VA. So if you want to go see a doctor down the street, a facility that's not associated with the VA, you'd have to get it through Medicare coverage, because the VA is not going to cover that except in some limited situations. So we got to make sure that where you're going to get your healthcare is very important to think over.
Yeah.
And then you have a completely separate program, which is TRICARE for Life, and that's for those who served in the military and retired. I believe the age is over 20 years. But you can, like I said, contact your local VA to see if you are eligible for that program. And TRICARE helps cover things outside the VA. So it's an additional level of coverage. It's like a secondary level of coverage. So Medicare, if you're going outside the VA, Medicare, and then it would pay after Medicare, whatever's left over that on you, it would help pay towards that. And same within the VA, a VA would pay first, and it would be the secondary. So kind of a supplemental insurance, but you can get access to additional benefits as well with that. And usually that all happens automatically in the background. And Champ VA works similarly. Like I said, with those two, talk with your local VA to see what all is covered and how that all works. But that's just the general overview on that.
Yeah. There's lots of different coverages out there for veterans. And you definitely want to make sure that the agent you're speaking to when it comes to Medicare is asking you all the right questions to gather all that information to understand where you're getting your health care from and what is going to be working best for you and providing the best protection for you. And there's a lot of different gaps that come along with that, and you just want to make sure that when you're receiving TRICARE VA benefits, that again you're getting the most out of Medicare.
Yeah. So we're on the Medicare side here, obviously Medicare Team. So we're going to dive into a little bit on that side of things here. So the first question that you should ask yourself if you're getting these benefits is, where do you plan on getting your healthcare coverage at? It's a good question that you can ask, and that's really going to determine what is going to be best in your situation. Do you want to get everything through the VA facility? If you're fine with that, it's going to be different options on the Medicare side of things that would be able to be more tailored towards you if you're gonna do that. Also, do you plan on getting everything outside of the VA? There's gonna be completely different needs for you when it comes to your Medicare coverage, because we're gonna need to find coverage that's more comprehensive, that's gonna cover everyone you need to see, all the doctors, all the medications that you would need to take. So that's a good question to ask yourself, where do you plan on getting your health care at? If you're getting it through the VA, you'll likely be able to get a little bit more benefits through your Medicare because they're not covering as much your doctors and your hospitals. You might be able to get a little bit more money back towards your Part B, uh, get a little bit higher dental benefit, and also get access to a gym a lot of times with Medicare Advantage. Next week they'll be going into a little bit more all about that.
Yeah.
Yeah, so
There's some veterans out there, some of my own clients that split their coverage between VA
mhm,
and Medicare. And again, where coming into trusting your agent is a big key in setting up your Medicare. Again, I have clients that can't get certain medications through the VA,
mm,
so they get it provided through a Medicare Advantage with a Part D plan involved in that. Again, there are veterans that have just Medicare Advantage. There's some that have prescription included in that. So again, it's really up to you to make sure that you are looking at, what are your options? What is it all covering? And what should you be receiving?
for sure, for sure. So, if you want to get everything through the VA, just make sure that your facility's within range. I know that some people are gonna be aging in, and might not have used their medical. Just make sure visit your local facility, make sure it's up to standards with what you want, and if you're not gonna go through the VA, then we're gonna need to make sure that you're gonna be fully covered outside the VA. So you're just gonna be getting your coverage through Medicare. So you're gonna have to then determine, is a Medicare Advantage plan worth it for you, or is a Medicare supplement plan worth it for you? And we have a previous podcast episode, Advantage versus Supplement, if you want to go more into the weeds into that. But you're gonna have to take it like everyone else. Everyone else who's going on Medicare if you just have VA. So that's not applicable to people who have TRICARE for Life or Champ VA. That works differently. But if you just have VA coverage and you're planning on getting everything through civilian doctors, then call us, call a licensed agent who works with the top rated companies around this nation to be able to get all your doctors in that you want to see, get all your medications, just make sure you got that coverage. Also be able to assess your needs. Do you need dental work done? Do you need vision? Do you need hearing stuff done? So you can always give us a call. You can book an appointment down below in the description, and we'd love to help you out with that. So if you're planning on getting everything outside the VA, that's definitely what I would recommend that you do.
Feel free to contact us for a free consultation, www.medicareteam.com/free. And we're happy to answer any questions, even if it means, we're not providing you with anything specifically today.
Yeah. Um, there's also some other coverage that would be good for everyone to have. So I kind of want to go a little bit into that. I mean, a little bit off into the weeds there. A lot, there are certain situations where you're going to have a lot of costs that are non-medical. That would be good to get coverage, and that's in everyone, whether you have the VA, whether you have Advantage plan. For instance, if cancer, 54% of Medicare of cancer costs are non-medical. So you want to go see a specialized facility somewhere. You want to do experimental treatment, like Medicare is not going to cover that. If you want the driving, and then also if you're working, lost income, a lot of gaps when it comes to there, because they're only covering medical side of things, so they're not covering the non-medical parts of getting cancer, which can be very drastic. Getting coverage in case you were to get a cancer, heart attack, stroke, to help give you just a lump sum of money tax free, they can use for whatever you need. So you don't have to put it towards medical costs. If you want to, you can go to Disneyland with
Yeah.
it. But it's up to you what you want to do with it. And then just making sure you got dental coverage, because a lot of times, even if if you just get VA, obviously this depends on your level. So talk with your local VA to see what type of coverage you have. But a lot of people in the VA, they don't have great dental. So you might need to get a standalone dental plan if you're just planning on going to the VA to make sure that you're covered. If you ever have any dental problems, vision, hearing, anything like that, making sure that you have coverage there so you're not having to experience those costs out of your own pocket.
Right.
Uh,
Yeah. And Medicare Advantage does provide those limited benefits with dental, vision, hearing.
mm,
If your VA only provides a certain number of benefit with that, you can always have Medicare Advantage pick up some of that as well. And
for sure.
yeah, there's ton other benefits that come along with Medicare Advantage, like a give back.
Yeah. Do you want to go into a little bit how the give back benefit works?
Yeah, so with Medicare Advantage, a lot of the veterans that I've helped here and are continued clients are receiving what's called a Part B give back or an increase in your Social Security, however you want to see it. And that is just to offset the cost of Part B of Medicare. And especially for those who are using VA benefits or
Yeah.
TRICARE, this is a great opportunity with Medicare Advantage to get some of that money recouped.
And you might not even know that you're paying it. If you're Part B, you don't have Medicaid at all, you're gonna be paying your Part B premium, which is like 202.90 this year. Is that
Correct.
correct?
Mhm,
Okay.
mhm.
Just wanna make sure I got the exact number there. That comes automatically out of your Social Security check if you're receiving Social Security. So you might not even know you're paying it. If you look at your Social Security statement, you'll see that it's automatically being deducted out. So reducing that cost is gonna help increase the amount of money you're getting in your paycheck, and we know, especially if you're retired, that living on a fixed income, every dollar counts. If we can
Yeah.
get even a few dollars back in your pocket, it's gonna be it can be very helpful.
Yeah.
So,
There are give back plans out there that vary in level of give back. I've talked to plenty of veterans that have no idea they're even receiving a give back or what they're currently on with a Medicare Advantage plan. And so that's why we're here to help, again, consult to make sure you're receiving the best benefits for you that are tailored to what your needs are.
for sure. And then there's also some other stuff. Obviously check with your VA to see what they provide in the area of home health care. So a lot of times Medicare, and then obviously check with the VA on what they would cover for this, isn't going to cover long-term care. So if you're not able to get around, you're ain't able to perform believe it's called termed the daily activities of living. If you're not able to, if you ever have someone who's a family member someone has to stay at home and watch them because they can't look after themselves, that type of care. Most of this type of care is performed by family members in the United States, but having coverage to be able to pay someone to come in so that your family doesn't have to bear that burden as well. So there are coverages out there that help cover that gap, and obviously check with the VA to see what level you're on and what coverage they have towards that. But having access to home health care benefits is also very, very helpful and something you should look into because the longer you delay it, that more expensive it's going to become monthly. If you get it right when you turn 65 or before you turn 65, your premium's got to be a lot less than if you're 76, 77, it's the and on the verge of needing it because you're going to want to get insurance not when you need it because obviously the insurance company is not going to be able to do that. You can't crash a car and then try to buy car insurance. You gotta get it before, it's for the in case something were to happen. Oh,
Yeah, for sure.
mhm,
And a lot of like ancillary products like dental, vision, hearing, those kinds of things require you to get them ahead of whenever that were to potentially happen to you, to build up what is called coinsurance. So, there's a waiting period to get that provided benefit. Sometimes it's 6 months to a year before you can utilize the most out of that
yeah.
coverage.
Well, let's go a little bit into the drug part of things. So
Hmm.
let's say you have the VA, and you're just becoming eligible for Medicare. You've heard about this thing called the late enrollment penalty for Part D. How does that all work with Medicare?
So you would receive a Part D penalty for not having prescription coverage if you are late to enrolling in it, and I believe it's 1% each month.
Yeah, with 12 months, but the benefit of getting that through the VA is that your prescription coverage through the VA is deemed credible, which means that even if you don't get prescription coverage with Medicare, you're not gonna have that late enrollment penalty. So that's a really
Right.
cool thing about having VA coverage is that you avoid your Part D late enrollment penalty if you join Medicare Advantage plan. Obviously, you may have to fill out some forms, just so that they can prove that, hey, you had coverage to the VA, but you won't have that penalty. You don't have to get Part D coverage if you go onto Medicare, unless obviously, like you said earlier, if there's a prescription the VA is not covering and a Medicare Advantage plan will help cover that, it might be worth it for you to look into that. Or if you don't want to go to the VA to get your prescriptions, a lot of people might want to get their prescriptions from a local pharmacy or through another source that the VA wouldn't be covering. I mean, obviously, like I said, 100 times this podcast already, check with your local VA because there's such a difference between the levels of benefits there depending upon what level you're on.
Right.
So,
Yeah, you could easily have a Medicare Advantage plan that has included Part D or prescription drug
mhm,
coverage. Or if again you're receiving all of your medications and doctors through the VA, utilize the Part B give back with just a Medicare Advantage only plan that doesn't
mhm.
include prescription drug coverage.
Yeah, because when a Medicare Advantage plan includes prescription coverage, a lot of times they have to allocate some of the funds they receive from the government to be able to help cover that. So, advantage of you being in the VA is you don't have to worry about the Part D late enrollment penalty. You have coverage through the VA. You're able to disregard the Part D coverage on Medicare's side of things so that you can get a plan that might have more benefits elsewhere because they're not allocating those funds to help cover Part D, which is D is for drugs, prescription coverage. So if your
Mm,
doctor prescribes you a prescription coverage for that. And let's go a little bit into prescriptions. So if you are seeing a civilian doctor and you want to get your medications through the VA, you are going to have to get them prescribed through a VA doctor. So even if like your civilian doctor's like, hey, you should go fill this prescription up, just make sure you go to the VA, you get your VA doctor to approve that, because since your prescription coverage is through the VA, you're not able to use civilian doctors to order prescriptions through the VA because there's two separate entities, which can be quite confusing and quite frustrating at times. But it's a good thing to be aware of if you ever do need a prescription. You are going to have to get that approved with the VA before they would be able to cover it. And they don't cover every prescriptions. A lot of times they're a lot of generic prescriptions. So you just got to coordinate with the VA on if your prescription will be covered. But a lot of prescriptions will be covered. So
Again, that's where talking to a licensed agent that you trust is going to be important because, again, if you think that you'll potentially be using Medicare Advantage for some of your prescription coverage, you're going to want to make sure that you have a Medicare Advantage plan that has that Part D included and not just an MA plan.
yeah. Um, and I've talked to a lot of vets over my time here, my dear old long time. I've talked with a lot of them. And some vets they're near VA facilities and they just get everything through the VA. They don't go outside the VA for anything. And there's some people that the VA facility is like 20 miles from them and they're like, I can't drive that long to go do it. So like I said, both those situations, it's going to be very different. If you're living around the VA, you get everything through the VA, you're going to want to maximize your give back benefit. You're going to want to maximize your dental, your vision, your hearing benefits, and also that gym membership you get through Medicare Advantage, especially if you're on TRICARE. Well, not especially if you're on TRICARE. TRICARE is a bit different. So let me go a little bit into that and how that can work. TRICARE billing happens automatically in the background when you go see a civilian doctor. So you may have Part A and B. It almost acts like a bit like a supplement. Obviously, it's a little bit different, and you can talk with if you do have it. Talk with your TRICARE person, the person who administers your TRICARE benefits on how that will all work. But a lot of times that billing happens in the background. So Medicare Advantage plan might not be the best option if you're going to go see a civilian doctor. And that's because what Medicare Advantage plans do is they can limit you to a network of doctors, and Medicare Advantage becomes the primary payer whenever you join the plan. So instead of original Medicare, which is through the government, which is parts A and B, and then you can add on a part D. A part C, which is Medicare Advantage, basically bundles that all together into one plan. And that will become your primary payer if you're on a Medicare Advantage, which can be great because they can offer additional benefits and protections. But if you're on TRICARE for life, generally, if you're seeing a lot of civilian doctors, it's not recommended because they can have networks, and a lot of people don't know how to bill it right. So at a facility, you may receive bills from on the Medicare Advantage plan, even though you still have that secondary coverage with TRICARE. So it just adds an extra step in you having to send those bills over to TRICARE for them to help cover them. So obviously it depends on your situation, but if you're TRICARE and you go into civilian doctors all the time, generally just because of the ease of using TRICARE, it's recommended that you just stay off of Advantage and just be on a Part A and B. But obviously it depends on your situation, what you want to go through with that. And that's the same with Champ VA. Like I said, talk with the person who administers those benefits for you on how all that will work.
Yeah, you can utilize Medicare Advantage still being on with TRICARE,
Yeah.
VA. You're just going to potentially have some extra steps in how it gets billed.
And more limitations.
Right.
Yeah, Medicare Advantage plans are great for a lot of people, but depending upon the plan you're on, you may need to go see a primary doctor now and get a referral to a specialist. It acts a lot like work insurance. If you've ever been on
Right.
work insurance in the past, that's how it works a lot like. But yeah, next
Yeah.
episode, we will have Jack and Thomas in here, and they're going to be going a little bit more into the benefits of why someone who is a veteran might want to go into a Medicare Advantage plan, and what your options, and all the benefits you'll be getting with that. This episode is just more of a broad overview on that, but we'll go a little bit into deeper on what you can get as a veteran. So.
Yeah. Yeah, it's been a pleasure, Joshua. And, if you need to, again, feel free contact us here at the Medicare team for any of your Medicare needs. We're happy to set up a free consultation with you, and we help people walk through this Medicare journey from now until they would like to have us as their healthcare provider. And to speak with one of our licensed agents, give us a call at 717-807-7649. That is a wrap. I've been Sean as a licensed agent here at the Medicare team,
And my name's Joshua, and I
and we'll
hope
see you in the next video.
yeah, see ya. We'll see y'all when we see y'all, and